It is April 3rd, 2025. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. Our patient is a Floridian, and he is suffering from debilitating lower back pain. It goes into his right leg when he gets it. His pain is coming from 3 discs in his back, the facet joints at L4-5, L3-S1, and the piriformis muscle and SI joint. He's got a lot of causes. He is morbidly obese. Lay still. We cannot put him too deep asleep, otherwise he'll stop breathing. So we got to keep him more awake. All right, let's get started. We're going to start by doing the laser surgery. A little bit of stick and burn with some numbing medicine. Because our surgery is done under propofol sedation, we can't put him too deep asleep, otherwise he'll stop breathing. So I'm going to do my best to get his surgery done as comfortably as possible for him. All right, if you have questions, feel free to ask. Otherwise, we're going to just focus on what we're doing here. All right, let me just see here. Sean? Sean? I think we're going to probably need it. Sean? Sean? When I say shot, I'm asking my team to take a picture. Sean? We're going to need the longer. Tell me about his blood thinning status.
He's been off it for...
What was he off? Okay. Is this lined up properly? All right. Sean? 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 Henry, since this patient is an example of someone with many causes of back pain, let's show the audience all the different possible causes of back pain.
Copy that.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. All right, welcome back. We are still working on trying to get to the spine at the second disc, struggling. Again, our patient is extremely, unfortunately, overweight, but a lot of that's because he hasn't been able to do anything for years, activity-wise, and because his back has been hurting him so much. We're going to try to fix that for him today. So, any questions, Sean?
Yes, we have a question coming from Alanu on YouTube.
Sure.
Asking, one of
Sean?
My friends has back pain and is getting a steroid shot. I told her it's just a temporary fix. I sent her your treatment videos. Is that the best way to convince her?
I think that's a good way. I think, for me personally, I believe, Sean, that people have to make up their own mind what they want to do. It's their body, their choice, their life, AP. I know what the right choice is for patients because I'm familiar with all the choices out there and the ones that work and the ones that don't work. That looks much better. And so I'm fully aware of what doesn't work. And unfortunately, shots are not going to work. But I think the best thing to do is just introduce her to the site and the videos and just let her, at her own pace, learn. I think you've done everything you can do as a good friend. Sean? 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 I don't know, Jordan. AP? I guess we're getting close, huh, Jordan? So on a level of 1 to 10, this is a very difficult case. This is not one that I would normally, when I was in the beginning, I wouldn't try to do this case, and neither would Dr. burned as I'm sure. All right, we're not able to get to the bottom disc. We're just going to be able to get to these two because of his anatomy. So we're going to treat these two. I just want to verify that we're inside the disc where we want to be. He's already going to be pushing the limits of our equipment, okay? And what that means is, there it is. You can see the tear. Shot.
Yes, we do.
What that means, folks, is that the tools we have, there's the other tear. Show us the tears, Jordan, on the lateral view, and let's get started. You're going to see in a moment our scope, our system we use to repair the disc. It comes out of Germany. It's the longest one available, and he's going to go just beyond the normal limits of that. We're going to still be able to get his surgery done, I believe, but it's not going to be easy to do. It's going to be really, really challenging. Let's see the knife. I want to make this a little bit bigger. Now, Henry, let's show the audience what we're about to do here to fix these damaged discs that are so painful for the patient.
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Here we go. All right, we have entered the tear, the painful tear, and the dilator, as you can see, for those of you who watch this a lot, is almost at the end. And you can see the tube we use is going to go all the way down. I can guarantee you that. Now we have to work somewhat quickly here in a measured fashion because our patient is very large, has sleep apnea, and is not going to tolerate being on this operating table too long. So I have to be very, very efficient with my movements and my surgery. Does that make sense? So, all right. Any questions?
Yes, we have another question coming from Lanu once more on YouTube.
Go ahead.
Asking, the patient is very overweight. Does he know he need to lose weight?
Yeah, of course he knows he needs to lose weight, Lanu. Unfortunately, he cannot. He's in too much pain, so he can only just sit around and be inactive. And that's the case how it is for virtually every person with lower back pain that's chronic. The activities make the pain worse, so they become inactive. Look at this. We are literally at the hilt. We have gone as far as this tube will go. So let's get this done. I'm going to keep working quickly. You're welcome to ask questions and ride along. This is one of the hardest surgeries I've done in many years. But I felt so badly for this man. Laser. Get the laser ready. Because his whole life has been destroyed by pain. And he doesn't just have one pain problem, he has many. To save that. All right, we are inside the disc. We're going to bring the laser in. You can see the tear. I've already removed one piece of herniation. And so far, things are going well for him. And you can lighten him up a little, Berndes, because this right here won't be as painful. If you want, whatever you feel. At the end, it'll be in about 8 minutes. 7 minutes, something like that. Grab her, stay with me.
He tolerated the choke up.
Yeah. Yeah, but you know, the truth is he can't really move that much, right? So getting off the table is not as big of a concern for me, for a guy like him, right? He's sort of locked in. It's just I want to keep him comfortable as much as possible. Do we have a weight, by the way?
339.
You documented that? All right. What?
Yes.
All right. Because it's important that's all documented. You understand why. Right? The operating table takes a certain limit.
That's what we used to
Hmm? Just a quick wipe. Don't stay there too long. All right. Any other questions, Henry?
At this moment, no current questions.
Now, he's going to have a few other procedures done. And like many patients, the cause of the back pain is not isolated to just the discs. It turns out that most patients with chronic back pain, there's the tear, by the way, that we're fixing. You guys see it?
Yes, we do.
Most patients with chronic back pain have more than one cause. As a matter of fact, the average number of causes on the average patient is 4. So the average patient with chronic back pain has 4 sources of their back pain. Could be 2 discs. Watch the other needle. It could be 2 discs, 2 facets. That's 4. It could be a disc, 3 facets. That's 4. It could be 2 discs, an SI, and a piriformis. That's 4. But the point is, the average patient with chronic back pain has 4 causes. We have to fix all 4 causes during their surgery. Otherwise, they're still going to have pain. And the pain will be coming from areas that we didn't fix. It's that simple. We've never had patients that had pain from areas where we fixed. It doesn't happen. All the patients post-op that have any kind of pain in their back, it's coming from an area we did not fix. Any questions?
Yes. Another question coming from Lanu once more on YouTube saying, how long can he lay on the table without moving?
Yeah, great question, Lanu. So in a perfect world, a patient would lay on the table without moving for however long the surgery takes. But the reality is the average patient can lay on the table for 2 hours. 2 hours. Now, you could probably get to 2.5 hours safely, but beyond 2.5 hours, you have to worry about respiratory fatigue. What that means is if you were to lay right now on your floor or your bed, on your belly, just facing down, how long would you be able to lay like that and breathe comfortably? How long till you start having trouble breathing on your own, right? That's exactly what these surgeries are like. So we make the patient comfortable as much as we can with medicine, but if the more comfortable you make them, the more sleepy they get, the less likely they're going to breathe. I'm getting to the painful area in about 2 minutes, maybe a minute. Grab her. So when you ask that question, there's no hard, fast number, but we like to use as a rule of thumb, 2 hours. Okay? We start getting nervous. Oh, that's a big piece. When we get to 2 hours. Yeah, Dr. Berndes says 2 hours will be pushing it for him. So, but there's some pretty good size herniation here. you know. Obviously, every time we do surgery on somebody, it poses risk of anesthesia and surgery. So the goal is to, oh yeah, that's a big one. Got a big piece out there. So we're doing really, really good. A lot better than honestly, than I expected at this level so far. Huh? Are you talking to me? We're at the end of this first disc. We're just about done. We're going to move on to the next disc in just a moment. I think right now this patient's, like today when I saw him, his biggest complaint is his piriformis. Right buttock. So we're going to make sure we get to that because that seems to be the biggest cause of pain right now for him. That will be after we stream the disc surgery. We'll go on to the piriformis. Yeah, we can do the SI last. So Henry, you hear that? We're going to do the disc, then the facets, then the piriformis, then the SI last.
Copy that. Perfect.
All right.
Don't worry.
That's a bit different than what we normally would do, but I'm fine with that.
I'm fine with that as well. Not a problem.
The facets will be quick.
Yeah. We do have a question.
Yep.
Coming from Pavel on YouTube.
Hello, Pavel on YouTube.
Saying, hi, doctor. If there is uncomfortable sensation when bending forward in the lower back, would that indicate facet problems?
Yeah, uncomfortable sensation when bending back could indicate facet problems, but it could also be something else. You're doing great. Hang in there. Don't move. You're doing great. We're almost done. Almost done, my friend. You're almost done. You're doing great. So, please don't do that. If that doesn't convince you, I'm at the outside of the disc where the nerve fibers, please don't do that, where the nerve fibers are, and the patient is really feeling it. He's not happy about it. And that just goes to show that when people have disc pain, it's always in the back of the disc. Just about done. 30 seconds. All right. Yeah, we're done here. Good. Done. Done with one. Done with one. You're doing great. We're almost done. What do you say? Scope off. You're doing great. We're almost done. We're going to put you to sleep again in a minute. Yeah. All right, so one disc down. Next one we're going to take this tube out. Yeah, so to answer your question, Pavel, we don't know what's causing your back pain. You can't say because I bend back. Come on in, come on. That's facets. Could be other things, so that's not diagnostic for facets. It could be facets, it might not be. If you want to know what's wrong, you need an expert to help you. That's me. And you're not going to find anybody else anywhere else because I'm a pioneer in the field of discovering, is that it? The source of back pain. So unfortunately for you, you have to have me figure it out for you. There's nobody else. And then once I've solved your problem, like why are you having back pain, then I'm going to offer you, can you hold this please? I'm going to offer you a solution. And that solution, again, is one that's only available with me. So in this day and age, 2025, if you want to be fixed, you need to come to Duke Spine. The good news is I can diagnose your pain almost always over just a video conference. Num num. So all you got to do is fill out the MRI review form on our website at dukespine.com. Henry will post a link right now, or Brandon will. I don't know who's going to do it, but somebody will post a link.
Yep.
You just go to that link and fill out the questionnaire, upload your MRI images, your DICOM images, so I can look at your MRI with you. And then we're going to have a video conference for 10 minutes. And in 10 minutes, I'll tell you why you have back pain. And more importantly, I'll tell you how to get rid of it. And if you decide to get rid of it, I'll get rid of it for you, like at Duke Spine. Okay? We are entering disc number 2. We're going right through that tear. You see that?
Yes, we do.
X-ray? Hold on. Did you guys see how the dilator went right through the black tear? Go.
Yes, we did.
Okay, we're in. Whoo, it's a deep one. All right, keep track of where that marker is. Nope. You won't lose it. Just push down on the fat. That's good. Let me have it. I'll help you. This is as hard as the surgery can get. Normally, doctors would not operate on a patient this big. They would tell them to go lose 100 pounds and come back. And the problem is, how is he going to lose 100 pounds? You know, it's very hard to do when your back is hurting you. You can't really exercise. You just kind of lay around and do nothing. Ready? Yeah. Have the other piece ready? Yeah. Shot? That looks good, I think. I think we're good. Yeah, you ready? Shot? We're in. You got it? Good job, Luis. Luis is the man, my right-hand man. All right, any questions?
Yes, we have a few questions. This next one is coming from, forgive me if I mispronounced this name.
I will not forgive you, Henry.
Okay, I will accept. No, this is coming from Mr. Sahirish, coming
Mr.
from YouTube.
Sahirish.
Sahirish. That's
Very nice.
coming from YouTube, asking, does a patient get to know how many procedures he or she needs from the onset?
Yeah. Absolutely, yeah. Listen, we are... Thank you for asking. I know it's funny because there's obviously many doctors out there and many experiences that patients have. But I suggest you watch our patient testimonials on our website. We have a patient experiences section. If you're having neck pain, go to the neck pain on the home page. If you're having back pain, go to the back pain sub page, and then you'll see there's a patient experiences, and it's basically hundreds and hundreds and hundreds of our patients that have had treatment here over the years. Oh, look at that herniation, big piece. Can you see that, Henry?
Yes, we do.
Yeah, look at that.
Yeah.
That's what's causing all the pain. It's causing the inflammation. Yeah, Luis has got the tape measure there. Anyway, we're not a Mickey Mouse kind of place. We don't screw around with people, lie to people. We're going to tell you ahead of time everything that needs to be done, 1, 2, 3, 4, 5, whatever, exactly which side, right, left, and we're going to tell you exactly the cost to you out of pocket, what you have to pay out of pocket before you come. And then we don't want surprises. We don't like surprises. I don't like surprises because surprises are never good. So we rarely ever get a surprise because typically using the MRI review, 8 minutes. We're using the MRI review. I can make the diagnosis 99% accurate, what's wrong. And we know exactly based on the diagnosis what has to be fixed. So the diagnosis drives the treatment. That is something very important to understand. Diagnosis drives treatment. Now diagnosis, degenerative disc is not a diagnosis. Herniated disc is not a diagnosis. They are findings on the MRI, but they don't tell us where a patient's symptoms come from. You must do the examination that I do on Zoom. With that examination, I can tell exactly where a patient's symptoms are coming from. And the fact is that if you have 5 degenerative discs in your back, maybe only 1 is causing pain or 2. It's extremely unusual that all 5 would. We've seen lots of people with 5, 6, 7 degenerated discs, but only 1 or 2 need to be fixed, and that gets rid of their symptoms. So we don't treat the MRI, we treat the patient. It's very important to understand. We're almost done. You're doing great. So remember, our patient is not intubated. He's twilight sedation, but we're limited on how much sedation we can give him because the more sedation he gets, the more he wants to stop breathing. Sedation makes you stop breathing. And since we don't have him intubated, we can't have him stop breathing because he will suffocate. And that's true for all of our patients. So we don't want that. And our anesthesiologist is carefully monitoring him. And I'm monitoring him as well. There's the tear right there. You guys see the blue? The blue stuff shouldn't be there.
Yes, we do.
It should just be white and it should be connected together. But there's a huge tear. And this is where all of his pain is coming from. So you're doing great. So I'm cleaning the tear. Don't move. You're doing awesome. And I'm not worried about the movement, Dr. Berndes. Like I said before, I don't think it's going to be an issue for me. There's no way he can lift himself off this table. All right. Any other questions?
Yes. This next question is coming from Paco on YouTube.
Paco.
Yes. Paco asking, "Hi, doctor. Would it be possible to perform this surgical technique without the laser, just using the grabber?"
No, it's not possible to do the surgery without laser. Laser is very important.
Next question coming from Lanu once more on YouTube, saying, "Is there a correlation between back pain and being overweight?"
There's no correlation between back pain and being overweight in terms of causation of overweight causing back pain. The only causation relationship is that back pain causes people to be overweight. But it's not the other way around, as most people believe. It's misinformation out there on the internet and by doctors, nurses, health insurance companies. Just there's a lot of misinformation, unfortunately. But back pain causes people to be overweight. Knee pain causes people to be overweight. Hip pain causes people to be overweight. Neck pain, not as much, but more of the back pain, knee pain, hip pain. Got just a few minutes left here, and then we're going to end this stream. Any more questions? These are all very good questions, by the way.
No current questions, but we do have a comment coming from Mr. Saharish once more on YouTube.
Sure.
Saying, "I have tried to submit DICOM images using the link, but it requires insurance card information. I am from the outside the U.S., and we
Okay.
do have..."
Let me
Yes,
stop him.
of course.
We just took away the requirement for the insurance card. I apologize. We didn't realize that that was an issue for patients, the potential patients like you. So we removed it last week. It should be gone. Is Gabriel there?
Gabriel and Brandon are right next to me, yes.
Can you have Gabriel just verify that there's no like A-B where maybe the B form still requires it or the A form requires it, and just verify that it's no longer required and submit, try to submit and not use it. But the requirement for insurance is gone, so you don't have to fill it out.
Gabriel just notified me that it's all verified.
All right.
Yep.
Thank you.
Of course. Other than that, no current questions.
All right. I'm almost done. Jordan, are you ready? So, when do you think he would be available to do another procedure, Berndes? Next week? No, I don't mean that. I mean from an anesthesia standpoint. Tuesday? No. Well, I'm thinking Patel can do his period. If we had to. All right, I'm just... you got to tell me when to stop, but I mean... Yeah, I mean, the disc is done. I just got just a few seconds left here. And then we're ready to do his facets if we need to, but unless you want me to skip him and go straight to Piri. Huh? Length of the what? Wand? All right, folks, thanks for joining us. This is it. We're just finishing the last of the discs. And again, our patient is a little tired, so we're going to assess him in a moment and see how he's doing. But that said, I feel good that we got these two discs treated well, and we got his nerves unpinched. We removed a lot of herniation. Any last questions before we end?
Yes, just got a question from Ping on Facebook
Sure.
saying, "Good morning, Doc.
Morning.
Do foreign insurances cover this procedure like Bupa?"
I don't know if foreign insurances will cover it. What happens is you get the surgery done, and then you submit the bill to your insurance and see if they cover it. But no, we're done. I'm done. You'd have to talk to your insurance. We don't do that for you. Done. All right, thanks for joining us. We'll be back in a moment.